Hi, everybody. My name is Louise Jackson. I see our attendee numbers are clicking in. So welcome to the session, all our alumni of the University of Michigan. Again, I'm Louise Jackson. I'm the Director of Alumni Career and Education at the Alumni Association of the University of Michigan. And I'd just like to warmly welcome every single one of you, our Michigan community and our Michigan alumni. We're really grateful for your attendance today, and I'm joined by these incredible esteemed colleagues and panelists, as well as our moderator for this incredible session that we're hosting titled Mental Health and Cannabis, Does a Gummy a Day Keep the Anxiety Away? Before we kick off the session and I hand it over to Dr. Ilgen, I'd just like to make sure I cover a couple of housekeeping items. Just a heads up, the session is being recorded, so please look out for an email from us at the Alumni Education Program with a link to that recording for follow-up. Another point of note, we have, due to the sensitive nature of some of the conversation and the questions, we request or ask you to kindly put your question into the Q&A feature versus using the chat feature. We have closed the chat feature down. Again, the potential clinical nature of some of these questions, we want to make sure that we respect and honor all the questions of you, our participants. So make sure you go ahead and use that Q&A versus the chat feature. Without further ado, it's my distinct pleasure to introduce Dr. Ilgen to us today. Just a fantastic pleasure to have you on board. Dr. Ilgen is the director of the Addiction Treatment Services, that's UMATS, and that's part of the Addiction Center within the Department of Psychiatry at the University of Michigan and Michigan Medicine. He's also a clinical psychologist, a professor of psychiatry, and an investigator with the VA Center for Clinical Management Research, CCMR, and at the VA Ann Arbor Health System. Much of his current work focuses on on improving the treatment outcomes for patients struggling with substance use disorders and complicated co-reoccurring problems, particularly chronic pain, psychiatric disorders, and suicide risk. Such a pleasure to have you with us, Dr. Ilgen. Just going to hand it over to you for this incredibly helpful session.
Great, thank you, Louise, and welcome everyone. We're really pleased to be participating in tonight's event. I want to begin by sharing a little bit about our two panelists, Dr. Morrow and Sarah Rollins. And after introductions, I'll ask them a few basic questions to get the conversation started about cannabis and its effects. And then we'll move on to questions from the audience that are posted using the Q&A function at the bottom of your screen. Please enter questions throughout this hour. The more questions we get from the audience, the more interactive the experience will be, and hopefully the more interesting. So to begin with, Dr. Jonathan Morrow received his BS in Biological Sciences from the University of Southern California and his MD and Ph.D. in Neuroscience from the University of Michigan. He joined the U of M faculty as an assistant professor in psychiatry in 2011, and he provides medication management and other clinical services for patients through the U of M Addiction Treatment Service. His clinical interests include the treatment of co-occurring psychiatric disorders such as addiction and post-traumatic stress disorder. Sarah Rollins is a clinical social worker at the University of Michigan Department of Psychiatry. She works with both adolescent and adult patients and has expertise in issues related to addiction. Her practice focuses on substance use through a developmental lens and the effects of trauma on the nervous system and how trauma intersects with substances of abuse. Sarah also serves as the adolescent and an adolescent and adult therapist within UMATS, which is a part of the Addiction Center. And she's been with UMATS since 2016. So just to kind of frame the conversation and talk about the topic of marijuana legalization, we found that as marijuana has become more accessible and legalization has expanded, so has use of marijuana. And there's a greater need to understand the ways in which marijuana is used and the effects of this psychoactive substance. Our work at the University of Michigan Addiction Center focuses on treatment, research, and education. And we are excited to have a conversation with you, our alumni and members of the community, to help you navigate the changing landscape of marijuana use. We hope that this evening's conversation will help to describe the pros and cons of marijuana use and differentiate between some of the addictive and non-addictive characteristics of the substance so that you can make more informed decisions about how to engage with cannabis. So to kick off our conversation, it would be helpful to hear from both of our panelists about their thoughts on the benefits and potential risks associated with cannabis. Many of us have witnessed different extremes when we hear about marijuana. On one hand, much of the media, especially if you consider the billboards you see while driving around Ann Arbor, expose the positive effects of marijuana, talking about treatment benefits and other benefits of the substance. But on the other hand, many of us, myself included, grew up with messages about the negative effects of marijuana, sometimes scare tactics about how dangerous marijuana use could be. So for both of you, I'd love to hear your thoughts on how you see the risks and benefits and how you reconcile between those two often extreme messages. Dr. Morrow?
Sure, yeah. I think that's exactly right, that we have these extreme messages, and it makes it difficult for people to navigate that and really separate fact from fiction with cannabis. Cannabis is, I mean, as potentially abused substances go, it's relatively low risk. It doesn't have the same sort of, like, for example, overdose risk that an opioid does or something like that. It's basically impossible to overdose on cannabis, and it does have some benefits, some things that people like about it, but it also has some drawbacks as well that we can talk about in some detail as we go on. But generally, the benefits are going to be milder and less impressive than what you would see on the billboards. That's usually true of things that people are advertising. But it's also not a death sentence or anything if you use some marijuana as well. So, but I don't know, Sarah, did you have thoughts on that?
Yeah, I mean, I think, I get approached all the time like, oh, you work at UMATS, or you work with addiction, you must hate marijuana. Like, I bet you didn't vote for it to be legalized. Like, there's no way that I would approve of it ever. And the way I think about it is just like on an individual case-by-case basis, because I don't think you can really ever generalize anything for the most part. Obviously, there's always cases to that too, but if we're talking about cannabis, like you said, there's definitely risks and there's definitely benefits. And I just like to look at how, if you're going to use it, it's affecting your life as a whole, right? So if you're going to use it, does it affect school? Does it affect home? Does it affect your mental health? Does it affect all these different areas? Because that's typically when it becomes problematic, not just the use itself typically. And I know that people typically have a hard time sitting within gray areas of like, wait, something can't be good and bad. Like, but a lot of things have the capacity to be both. And so it's kind of like sitting in that and with marijuana.
Mm-hmm.
Oh, that's a really helpful way of thinking about it. And I was wondering if you could talk a little bit more about some of the benefits, both clinically and based on your knowledge of the research. What are some of the benefits that you hear about most, and which of those do you find most compelling?
Well, so I can just think about the reasons people will use cannabis, at least what they tell me that they're getting at. So one thing is, I mean, I think the main thing that people get out of it is just enjoying it. It's just there's a certain level of euphoria that comes with using cannabis. I think that's the main reason people use the substance, and it's effective for that. It works. that's why people will come back to it. I don't know that that's like a life goal or anything, but that it helps with that. some people take it to reduce anxiety, as we measure, kind of take the edge off and bring them down a little bit. And for most people, it does have that effect. It's not an overwhelming effect, but it does tend to reduce anxiety, at least acutely, when people take it. It makes people sleepy, so some people take it in order to help with sleep. And some people will take it for pain, and again, it does have some analgesic quality, so it can reduce pain to some degree. With a lot of these things, though, I would compare that to other medications that do a similar thing. Usually, the other interventions that we have do a better job, really, than cannabis. They don't come with the euphoria, which is why I think some people prefer cannabis for that. But it does have some of these effects. Yeah.
And Sarah, for you, anything you want to add to that?
Yeah, I think there's another aspect, especially to adolescent use, that there is just a normal degree of experimentation as adolescents. That, again, it is normal for adolescents to experiment with substance use, and typically cannabis is part of that, maybe alcohol too. And then that might lead to more social use. The analogy I use is if all your friends are bowling, and even if you don't like bowling, eventually you might start bowling because all your friends are doing it. So that's kind of how I think about substances, and just kind of the reasons Dr. Morrow was talking about. But especially with adolescents, maybe to fit in or to feel different or to feel better, and it might not be overt pressure to fit in, but it might be like, kind of covert pressure, like everybody else is doing it. And so they're not pressuring you, saying like, I'm not going to like you if you don't do it, but there's that like underlying pressure there.
Mm-hmm.
What about the other end of the spectrum? Side effects, any withdrawal effects? What are some of the downsides that you see?
Yeah, so some of the reliable side effects of cannabis are they're mainly mental. So you get memory problems with cannabis use when you're intoxicated on it, is what I'm talking about. So there's memory deficits, there's attention deficits that come with that, slowed thinking, slowed reaction times, a little bit of motor coordination problems. So all of these things, at least with low levels of cannabis use, you get those. With high levels, you can get a lot more disorganization and even hallucinations and psychosis that actually can be dangerous depending on what situation you're in. But at I'd say like a regular or low level of cannabis use, those are the side effects that you could expect. There is also a withdrawal syndrome with it. And usually as with most substances, the withdrawal is like the opposite of what the intoxication effects are. So the most common withdrawal symptoms are increased anxiety, insomnia. There's some loss of appetite as well with that, and nausea that you can get. And some people experience this to a greater degree than others, but that really impacts the usefulness of this drug, because if you're using it for anxiety or for insomnia, it doesn't take long to develop enough tolerance to it that you're going to get some withdrawal. I mean, this happens within days with cannabis. And so then if you're using this and you stop using, which happens, on a daily basis, now you're going to have increased anxiety and trouble sleeping. And very quickly you get into a cycle where you're using cannabis to treat cannabis withdrawal. It's not so much the anxiety that you naturally have, it's the anxiety because you don't have cannabis on board. And then it becomes very difficult to stop the use of it.
And we actually had a question in the Q&A about habituation and tolerance. So you mentioned tolerance with withdrawal. Are those the same, tolerance and withdrawal, or habituation? Can you talk a little more about that?
Well, so they're very closely related. So tolerance means your body adjusts to so cannabis acts on cannabinoid receptors in the brain and throughout the body, and your body's going to adjust to constantly being stimulated on those receptors by kind of down regulating them or making them less reactive. And so they're also going to be less reactive to the cannabinoids that you make normally in your own body. That has effects on your brain and body. So when you're tolerant to it, that means the cannabis that you use is going to have less of an effect on you. And it also means when the cannabis is not there, now your body has compensated so much that you're going to feel its absence really at that point. And that's what withdrawal is.
Sarah, do you have any other, in terms of seeing adolescents, side effects that you would want to highlight?
Yeah, I think a couple important things about adolescence is the brain development. The prefrontal cortex, which is like right here on your forehead, doesn't fully develop until we're about 25 years old. It doesn't mean it doesn't develop at all, but it's kind of in process. And this is, kind of our decision making, impulse control, other things too. But cannabis affects this part of our brain, and so adolescents already struggle with decision making, impulse control, those kinds of things, and so it's kind of a double whammy because it's halting that. And then, like I said, adolescents, because the prefrontal cortex isn't fully developed, so it can halt that decision-making process, which can affect school, all the things that adolescents are doing. Another thing that I see really frequently when adolescents stop using that contribute to them starting use again, I would say the most common factor is adolescents saying they're bored. And one of the reasons is because of, again, they develop tolerance and the changes in their brain and the dopamine. And so when they don't have all that, things aren't exciting anymore. And so things that used to be exciting are no longer exciting. And so they kind of have to wait for, and I'm not a doctor, so I don't know all the neurotransmitters and all this stuff, but they have to wait for the chemicals in the brain to kind of rejuvenate because they got used to things being different while high. So the biggest thing I get is I'm bored. And then when youth, adults too, but more youth relapse, I ask them why, and they say, I was just so bored. So that's one of the things that I notice.
And both of you alluded to this with some of the symptoms you were describing, but I'm curious, can you talk a little bit about cannabis use disorder and the development of a disordered use? Is that a thing? And if so, what does it look like? And maybe how would someone know if they're moving down the path towards a cannabis use disorder?
So I can at least start that, but so cannabis use disorder is definitely a thing. It is an addictive substance, and it looks cannabis addiction looks fundamentally the same as addiction to any other kind of addictive substance. It's less addictive than most of the other ones that we think of. It's less addictive than cocaine and heroin and alcohol, in the sense that your chances of becoming addicted to it if you use it are lower than with those other ones. The estimate is it's about 8% of people who use cannabis will develop a use disorder. as opposed to like 12% of people who use alcohol will develop a disorder. Of course, that's from the 90s, that study, which cannabis is a lot stronger now than it was in the 90s. It's like 10 times stronger now. But if someone actually develops a cannabis use disorder, that's just as devastating and difficult to overcome as addiction to cocaine or heroin or something else like that, because it can affect all kinds of areas of your life. And I've seen many people who had addiction to multiple substances were able to stop all of these other ones and could not stop the cannabis use. So
yeah, I definitely echo that. I've seen that too, where people have gotten off heroin, crack, cocaine, and cannabis has just been like that one that they really have a hard time getting off of. And I think there's many reasons for that, including how, socially acceptable it is, how available it is, the stigma around it, and how like, oh, no one can get addicted to marijuana. And so then they feel like, I've had clients tell me like, well, I feel weird that I can't get off of it. I should be able to. But if we want to get like to the nitty gritty, there are technically 11 criteria that make up any substance use disorder. And then they go into categories like mild, moderate, and severe. I kind of think about it like salsa, right? So you can have kind of different levels. And substance use disorders are progressive. So over time, they get worse if they're not treated. So a lot of people think like, oh, I have a mild use disorder, I can just keep using at the level I'm at and it will be fine. What we've seen both in the literature and with our patients is that that's not what happens, is that substance use disorders get worse. And so we've talked about tolerance, we've talked about withdrawal, craving, so like urges or desires for use. Other symptoms include, difficulty maybe with like mental health or how it affects our physiologically. Recurrent substance use in situations which might be hazardous physically. Substance use and continued despite knowledge of having a persistent or recurrent physical or psychological problem, right? So maybe that when you use, maybe there's some psychosis that happens or worsening mental health, yet you continue to use. So those are just a few examples. But I think there's resources in the chat. You can always schedule an appointment if you're concerned or a family member has concerns.
Well, and that was part of what I was wondering is, are there things people can be on the lookout for? Is it really just those symptoms that you mentioned, Sarah, or are there other signs for either an individual or they're worried about a loved one where it feels like maybe this is at that tipping point from using it being positive to maybe starting to feel a little bit problematic? Do you have any tips for how to know?
So I think one of the difficult aspects is denial. I'm going to be honest. I don't never met someone who wants to just raise their hands and say, I have a problem with something. Like, I know I don't, like, regardless of if it's a substance or I have a problem with this math homework, like whatever it is. I think we as humans have difficulty just like naming that we struggle with something. And so I think it's sometimes a challenge because maybe as a parent, we see our child, we see that their grades are dropping, that can be a sign. We see that they're lying. We notice that they're, those are common signs like grades dropping, lying, skipping school, the common like red eyes, but that doesn't always happen nowadays. We have eye drops, stuff like that. So, but I think I will be honest, I think trusting your gut as a family member and saying like there's something off and maybe you don't know exactly what it is. I know at UMATS, like at least in the adolescent program, like we see families, even if their children aren't engaged in treatment, because we know that seeing the motivated party is really important. And sometimes youth are not motivated to change. And that happens a lot. So I would just trust your gut as a parent. I mean, you've gotten this far, so that would be my advice.
So, Dr. Morrow, anything to add to that?
No, I think Sarah said it well. I would say that a lot of those criteria, what it boils down to is a loss of control over the use, where you were using it for whatever reason, but now that reason has expanded and it's taking over more and more of your thoughts, more and more of your behavior, spending all this time using, and everything gradually comes to center around this substance use. And that means other things become less important. School, hobbies, sport, whatever you were into before loses its place to the substance. And if that's happening, it's hard to see in yourself a lot of times, but that is going to mean that you have an addiction, probably. Yeah.
Well, and we have a number of questions in the chat about other mental health disorders, and that's probably appropriate because some of the framing of the title of the talk alluded to the use of cannabis for anxiety. So I'm just going to start with a few of these. Can you talk a little bit about, let's do anxiety first. Can you talk about the use of cannabis for anxiety? What do we know about that relationship between cannabis and anxiety?
So we know that cannabis will reduce anxiety in the short term. So if you use cannabis, for most people, you're going to feel less anxious. Some people actually get more anxious. Some get really anxious when they use cannabis. But for most people, it's actually going to reduce the anxiety for a few hours, maybe, or less. And that happens pretty reliably when you use it. It's not a super strong effect. The issue with using that as a treatment for anxiety is that, as I said before, you'll get tolerant to that and you'll have withdrawal from it very quickly, which means you're going to increase your anxiety overall. And so then ultimately that's going to raise your level of anxiety over time and make you more and more reliant on higher and higher doses of cannabis to control that. So there's good data that it can induce, not really an anxiety disorder, but something that looks a lot like an anxiety disorder because you're using constantly to overcome that. Very occasional use, it's not going to have that effect, but cannabis stays in the system so long. I mean, if with one use for someone who's never used it before, that's going to be in your system at least a week. And you're going to have, even though you don't feel high, you're still going to have side effects from it for about a week. And with chronic use, it'll take at least a month, maybe even 3 months to clear out of the system. So if you use it once a month, once every 3 months, you're not going to develop tolerance to it, and you're not going to have these long-term effects on anxiety. But that's not how most people use cannabis when they do it.
What about mood disorders? Maybe for you, Sarah, can you talk a little bit about the impact of cannabis on mood and what you see related to depression and cannabis use?
Yeah, so I would say, just people coming into my office, typically what I see is they come in with both. They're like, I feel really down, I feel really depressed, or really anxious, kind of fill in the blank of how they feel, but usually not good. And then I'm also using cannabis. And I'm going to quote one of my old coworkers who has this great analogy of, if we were a house, cannabis is the fire, right? So if we have a fire, and then the mental health is like the wires within the house. And so first what we have to do is we have to put out the fire before we can get to the inner workings of the wire. And so there's this common question of like chicken or egg. Did like the cannabis cause the mental health, or did the mental health lead you to use cannabis? Because a lot of people come to me saying like, the reason I'm using cannabis is because I'm self-medicating. Like that is such, and even parents come to me saying like, I think my kid is self-medicating, and we just don't know, right? Like at that point, like when they come into my office. And so what we have to do is we have to get them sober, because it's like, I can't go into a burning house and assess. And so typically what I do see though, is that once we've stopped the cannabis, symptoms of depression, anxiety, whatever, typically go down. There are cases where it goes up, and usually that goes up when there's withdrawal, because again, like Dr. Morrow was talking about, there's a little more anxiety, right? Because it's the opposite of what happens when they're intoxicated. But typically there's a reduction in symptoms once they have maintain sobriety for over that month, 2 months, they've gotten through that sustained withdrawal. So I'm not saying they don't have any mental health concerns, but I've seen people reduce how much psychotropic meds they're on. They typically feel better. And so it's not, again, that they don't have any mental health concerns, but they're less once we've taken them off the cannabis, even though that's very hard. So I don't know if that answers the question, but.
I'll just add from a research perspective that there's not really much evidence that cannabis causes mood disorders. Like it doesn't cause major depressive disorder or bipolar disorder or something like that. There's pretty good evidence that it makes those worse. Both by interfering with the treatments that we give for that, and by just the cycle of use and withdrawal, destabilizing mood. And as I mentioned, euphoria is one of the effects of the drug. So one of the symptoms in withdrawal is low mood, and also with the intoxicating. I mentioned that with the intoxication, there's a loss of motivation that goes with that. And so people tend to just kind of sit around playing video games, it's a kind of a stereotype, but that's a real effect of the drug. And that looks like depression. That's one of the effects of depression. So it can exacerbate a lot of these symptoms. It also makes it difficult to separate out the effect of the drug from an actual mood disorder that needs treatment and things like that. So it certainly doesn't help. There's absolutely no evidence for that with mood disorders. So I would recommend, if someone is having this issue, that's, if you're going to self-medicate, that's not the best choice for a medication for that. Yeah.
And there is one question in the Q&A about bipolar. You alluded to this, Dr. Morrow, but can you just say specifically, is there any evidence that it can move, that can affect moving from a depressive end to a hypomanic or manic end of the spectrum?
Yeah, it doesn't really put people into depression or mania per se, but it does, as I said, like it can interfere with those mood stabilizers that people are on, and it can destabilize the cycles, just the daily cycles that people go through, And anything that does that is gonna, including sleep, and anything that does that is gonna make people more likely to have a mood episode, either up or down. It's just gonna make it unstable overall. So, and again, this is what people use it as a mood stabilizer. There is no evidence that it works as a mood stabilizer. It's kind of the opposite. So.
And two other psychiatric conditions that have been mentioned that I want to ask about are ADHD and then PTSD. So maybe Sarah, you can talk in terms of what you see with patients with ADHD in adolescence. Do you see that relationship frequently where people feel that it impacts their ADHD symptoms, and kind of how does that look?
Yeah, I mean, that's kind of what I was talking about earlier. So a lot of ADHD symptoms kind of reside in the prefrontal cortex, decision-making, impulse control, kind of task management. One thing that tends to happen with individuals with ADHD is like with the impulse control, they kind of have a hard time slowing down. So like making decisions, they tend to go really fast. So for example, a lot of my adolescents tell me they're actually better drivers while smoking, which is false, but that is, I'm just quoting my adolescents. And so it's hard because perception is not always reality. So the perception is I'm a better driver, and they may have ADHD, and so in the short term, yes, it slows them down, which is something they struggle with, or adolescents may struggle with actually sitting down and doing their homework because, again, they're so hyperactive and they're going through one thing and another, and they self-report that when they smoke, they're like, no, I sit down and do my homework. And so it's difficult because even with anxiety, it's like sometimes I've had this feeling where something is just so anxiety producing, I just want it to go away and I don't really care about long-term effects. And so I think we've all been there. So I think one of the things we have to really consider is short-term solutions versus like long-term solutions. And like in the short term, anecdotally, they say it helps, right? And I'm not here to fight that. I'm not here to say like your self-report is wrong. Like I would just, first of all, I'm never going to say that, but that's their experience. I'm not in a car driving next to them to self-report back. But that the anecdotal experience is that. I don't have, Dr. Morrow, maybe you have evidence elsewhere, but I don't think long-term it has that effect, again, because it does affect the prefrontal cortex, which is part of that decision-making impulse control, which is interrupted in ADHD.
Yeah, and I can say from a research perspective that I mean, it certainly backs up and I've seen this as well anecdotally. People do feel like it improves their ADHD. A lot of people do. I think it's because it has that effect of kind of slowing people down. And that's also borne out from the research. When you study objectively, people do slow down. They're more careful with driving per se. But they're also worse at performance. so they're slowing down, but they're not actually making better decisions. They're making worse decisions. They're not integrating the information well. They may not perceive that that's happening, but if you test that rigorously, that actually is what's happening. So sometimes I'll ask somebody who thinks that they're getting an improvement to, if once they've used, put together a 1,000-piece puzzle. And that never works out. That's right. People think a lot. They think they're getting a lot. People think they're hilarious. Like it's just not necessarily true, and it's not borne out by the research. So again, it does improve their perceptions of their functioning with ADHD sometimes, but actual performance is not improved. Yeah.
And maybe as our least final for now question related to psychiatric conditions. Can you touch on PTSD? There's a lot of information out there in the literature, and you'll see in the newspaper reports of people finding that that cannabis really helps them. I know a lot of the advocacy for legalization for cannabis came from groups of veteran patients with PTSD. Can you speak to that literature at all?
Yeah, it's a pretty interesting area of research because there is evidence that cannabinoids, it's kind of emerging evidence, but it looks like cannabinoids probably could be useful for PTSD. There's some studies where you give it in a prescribed way, it can reduce some symptoms of PTSD. It's not clear which components of the cannabis plant, because there's actually hundreds of chemicals in a cannabis plant. Which of those is most useful for PTSD? Which patients would actually benefit that? Because probably not everyone would benefit from that. What dose? There's a lot of unknowns with that, and there hasn't been a study that shows that just people just going out and using whatever marijuana is going to improve PTSD symptoms. So it's a little unsatisfying, but I can't really recommend that somebody use that without a research base behind that says this is how you use it, this is the dose, and these are the documented benefits that we would expect from this. It just doesn't exist right now. Hopefully it will in the future, but the other possibility there, because it hasn't been studied so well, is that for some people it's going to make it worse, and in some circumstances it could make the actual disorder worse. So that's why I say it's a little unsatisfying and unclear, but that's the state of the research right now.
That might be a good pivot point, because you mentioned the fact that marijuana contains a whole bunch of different ingredients, and as you know, there are now a range of products available, from those that have THC completely taken out through to those that have very high THC. Can you talk a bit about, maybe we could start with, to what extent does the conversation that we've been having about cannabis, which I assume means cannabis with THC in it, how much of that applies to products where the THC might be removed, or maybe you're talking about CBD?
Yeah, so what we've been talking about is almost exclusively been talking about THC, like high THC products, which is going to be any kind of cannabis plant product is going to be high THC. Some of them claim to be low THC, but as I mentioned, the THC content of these plants that's been tracked over time, and it is just I think it's like 28% THC on average right now, whereas in the 70s it was more like 1 or 2% THC in those plants. So they're all very high THC content. Now there are some products that are CBD, cannabidiol. That's a very different chemical. It's also a cannabinoid, but it doesn't have the psychoactive effects. It's not going to have that euphoria and all that kind of the kind of things that you would get from THC. It may have some benefit. Again, the research is very unclear. It may have some benefit on certain psychiatric disorders. But I'll tell you that the products that are out there typically don't contain nearly enough CBD to actually have any effect. They're mostly placebo that's out there. And a lot of them, because it's not really regulated by the FDA, a lot of them actually contain some THC, even though they're saying that they don't. I think that's because that sells better, because you actually get some kind of noticeable effect out of that. And you know, if a retailer doesn't have to tell you exactly what's in their product, and they can, you know, they're not going to get any kind of legal trouble by omitting that there's THC in there. They're probably going to tell you if there's that there's no THC in there, if it'll sell more. So the CBD maybe can be useful, but most of the products out there aren't actually going to deliver that in a way that could be useful for most of the things that people want to use them for. So sorry to say, but it's but that's what the research shows.
And Sarah, in terms of the products people are using, what do you see? Are people, you know, people using different edibles, tinctures, ointments, or is it still primarily smoked? I mean, what does it look like in the real world? And then what do you know, based on your experience, about the impact of those different ways of consuming cannabis?
Yeah, I mean, I just think everybody has their different preference. So I can't speak and say like, this is the majority. I know kind of dabs and vaping are very popular, especially within the adolescent community. And like one of the reasons vaping is really popular is that it's odorless. And so it's easier to hide. You know, you can do it out in public, and there's not that like very potent cannabis smell. So again, it's like people don't necessarily know. And so like we know that these concentrates have like as much as like 90% THC in them. And so like those are more of a concern because of how much THC they have. Other things I hear are just really popular. Edibles still, you know, still just like, you know, smoking it normally. I mean, I do have people use tinctures. I have people use it in every way, but those are typically the ways I see it. But again, I think it's just like kind of what you have access to, what people around you, like there's just so many reasons you're going to do it in different ways. But also the way the kind of the street names of it change all the time. And so even sometimes I have to ask my adolescents, like, what is that exactly? So, because I can't keep up with like all the different names and the way they use it. And so that's what the internet's also for.
Well, a couple other questions here. I'm cognizant of the fact we have about 15 minutes left. Can you talk about cannabis-induced psychosis? We have more than one question on that. What do you know about that phenomenon? How common is it? How problematic is it if and when it occurs?
Yeah, so this is another thing that's developed. Our understanding of that has developed a lot over the last several years. So, so cannabis can induce psychosis. Usually, when taken in high doses, that can, and psychosis meaning people just really lose touch with reality to some degree, sometimes to a very extreme degree, where they're hallucinating and delusional and believing all kinds of, you know, who knows what kind of conspiracy theories or whatever it is. So that if you use high doses, that can happen to pretty much anybody. If you're already prone to psychotic episodes, say you have bipolar disorder, say you have schizophrenia, something like that, it'll take even a lower dose of cannabis to bring those kind of symptoms out, those psychotic symptoms. That usually goes away once the cannabis clears out of your system. And that's not going to take more than a few days usually. with cannabis. Often it's, you know, that same day it'll clear up. But it, in a minority of people, it can actually develop, instigate a schizophrenia or some kind of psychotic disorder that's not going to go away. We're seeing that more and more as the cannabis becomes more potent, especially synthetic cannabinoids. Those really seem to have that effect. Those aren't as popular as they were before. The K2 and spice and things like that have that effect. But yeah, there is I mean, it actually increases, they estimate that it increases the risk of schizophrenia by about 40% using cannabis, which is a big number, but you have to keep in mind that schizophrenia is not that common a disorder. So it's, you know, 1 or 2% risk to begin with. So your personal risk is not going to be that high of developing schizophrenia, but it is like from a public health standpoint, that's actually a significant risk of cannabis use. Yeah.
We have a couple questions about pain, and I know that chronic pain is one of the more common reasons why, especially in the days when we only had medical and not recreational cannabis legal in Michigan. It was a common reason that people obtain certification for medical cannabis. Can you talk a little bit about cannabis as a pain reliever? What do we know? Is it effective? And then maybe, you know, how does that factor into your understanding of some of the consequences we were talking about, like developing tolerance, withdrawal? Does it matter why you're using when you think about those things?
Well, in terms of tolerance and withdrawal, it doesn't matter. That process is going to happen regardless if you're using the it's just a physical process that happens. So in terms of its effectiveness for pain, it does help with pain. That's very clear from the research. It does reduce pain. It's not the best at pain relief. And given the side effects, it may not be the best choice for, I mean, you know, ibuprofen actually works better for pain than cannabis does. Again, it doesn't come with the euphoria, but it you know, it's effective for pain. So it's the side effects are such that it's not generally something that we would recommend for pain control, just because we have better products that do a better job with it with less side effects. Where it may play a role is in people who are using opioids for pain control. It may be useful for reducing the amount of opioids that they need for pain control. That's going to be I mean, where that's appropriate is a small percentage of people, because usually opioids are not something that you should be using for more than a few days anyway. But in a minority of people who actually that makes sense for them to use opioids chronically, then cannabis might be helpful in that situation. But it's pretty limited, really. If I'm a pain physician treating pain, that's not going to play that big role in my practice, I don't think.
Sarah, what about for you? I'm assuming when you're talking with your patients, they mention a number of medical reasons that they might use. How does that factor into the conversations you have with them?
Yeah, I mean, as a social worker, I'm always coming from a place of I'm here to honor my client. I'm here to honor my patient. And so I'm never going to come and say that's not your experience. And so I'm not in their bodies. They know their bodies best. That's what I truly believe. And so if someone's coming to me and saying it really helps with my pain, that is their truth. And kind of like I said earlier, I like to look at the whole picture, kind of like what Dr. Morrow was saying. It's okay, yeah, maybe it slows you down, but can you put the puzzle piece together? Can you do you smack your head on the door because you don't have good balance, right? Like kind of all these things. And so I, as a social worker, like I'm not here to tell someone what to do or what not to do. I'm here to help them figure out what's best for their lives. And so I have patients who continue to smoke marijuana because that's what they believe is best for them. And I continue to treat as long as I feel like it's clinically appropriate. Sometimes we work through, it's like, okay, well, what's maybe a better solution to get all of your needs met, because maybe cannabis helps in one way but hurts in another, and is there a solution that's a win-win? And so that's where I'm coming from, like a place of curiosity and exploration rather than punitive and judgment, because when you're in pain or when you're anxious or when you're upset, like if something's right there and it's going to help in the right then, like it's sometimes we just need that immediate relief, and I get that. So that's my stance on that.
And what about the pros and cons of cannabis versus other medications? So you guys, well, all of us are in a psychiatry department. Psychiatrists use medications to treat conditions that all have their own side effect profile. How do you, a lot of times when people talk about cannabis, they compare it to other things. And maybe for you, Dr. Morrow, how do you think about the risk-benefit profile of something like cannabis relative to a different anxiety med or an antidepressant or other medications that you consider for someone?
Yeah, it's just, I mean, we kind of talked about some of the side effects that you can get from cannabis throughout this session, but so it's kind of a lot of side effects that you can get from it. So with any of these conditions, I can pretty much always find there's almost always a better medication for that, something that works better, that has better, and I'm talking about from the research, there's like better effect sizes, and has less side effects associated with it. So, I mean, we have cannabis on our formula. We have THC on our formula. We don't use it very much, and the reason is because it doesn't work very well for a lot of these conditions. So, I'll try something else, and cannabis, if it's on the list, it's going to be at least 3 or 4, like 4 or 5 on the list of things to try for whatever disorder that you're talking about. But for psychiatric disorders, anxiety, it's ultimately going to make that worse. So there's no way I'm going to prescribe that as a treatment for them. I'm going to prescribe something like antidepressants, which don't have the addictive potential. They don't have the tolerance and withdrawal potential. They just, when they work, they just make it better, and that's pretty much it. So that's a much better solution from a prescribing standpoint.
What is I was wondering, I saw you unmute there, Sarah, but I'll throw this to you. But what is the prescription for? I mean, if there is medical marijuana, what is that prescription? What is recommended? I don't know if that makes sense, but it's a couple of the questions in the chat are getting at frequency, mode of administration. Is there a prescription that we know works for cannabis?
Well, no. I mean, so I mean, there was the medical marijuana law that allowed people to prescribe, but the people who wrote that and put that together were not prescribers by and large, and so they really didn't have the knowledge to put together a dose and a regimen, and none of that has been worked out really for almost any of these disorders that people will use it for. I would say that, you know, from an addiction standpoint, the gummies are going to be less addictive than something like smoking or vaping that gets a high concentration of the drug to the brain very quickly. That makes it more addictive. But the gummies are going to give you just as much tolerance and withdrawal as the other forms as well. So, so I would say doing it very intermittently is the only thing I could say in terms of avoiding the tolerance and withdrawal. So going weeks at a time between uses, that's going to avoid that whole cycle. But yeah, I don't have much else to say other than that because the research hasn't been done on that.
Yeah. And maybe as a final question, there are a couple of questions about people that are using somewhat regularly but don't get side effects or don't seem to have adverse effects. Maybe for you, Sarah, I mean, is that something you see? And what do you make of that?
Yeah, I mean, there's always exceptions to the rule. And another thing to think about is that you're not going to have withdrawal effects if you continuously use. So what I wonder about those individuals, if they stopped using for a couple of days, what would happen? So I don't know, and maybe they would be fine. Some people's systems just act differently, right? Some people get immense anxiety from smoking and some people don't, right? So not everybody's systems are the same, but a lot of people say, oh, I'm drinking every day or I'm smoking every day and I have no withdrawal. But then I say, well, when's the last time you stopped? And you didn't have that substance and they can't remember. And so what would their system be like if they didn't? So that's just something to consider because they might not have cravings either because they're using every day. And so they're fulfilling that void. So that would be my response.
Yeah, and it is variable. It does, like, not everybody is going to get withdrawal even when they stop. So, it varies person to person whether they'll get this syndrome or not. Yeah.
Wonderful. Louise, I see you appearing here, which means
Yes.
we're probably right at the top of the hour.
We are at the top of the hour. I have learned so much from each one of you. Thank you so much, Dr. Ilgen. Thank you, Dr. Morrow and Sarah. Fascinating conversation. I know there were a ton of questions and we actually didn't get to all those questions. Our apologies in advance. We are going to be sharing a follow-up email tomorrow. We will be linking to the Addiction Center at Michigan Medicine. Please look out for the resource list that they share. Specifically, again, all the resources that are available to you within the Michigan community. We really want to make sure you get your question answered or you get the help that you may need. So please look out for that email. I just, again, want to thank each one of you for your time, for your expertise. We're really grateful. We've popped a link in the chat. Please let us know how we did. Give us some comments, give us feedback. Let us know how we can improve so we can continue to make sure we're getting the resources and the education and the help to you that our alumni need in the alumni community. As well, just check out again the link to the resources that my colleague Brooke will post in the chat. And we're going to call it a top of the hour. Thank you again so much to everyone for joining, and go Blue. Thank you so much.
Great, thanks.